Good morning, friends. Welcome to our next learning session. And today I am going to tell you about the effects of alcohol or ethanol on body. Let us see first few diagrams to understand the body. See this. This is the picture of skull. This is a picture of human skull. What is this? This is the face side, that is front of the skull, and this is the back, the portion towards your back. This is the portion upper portion where hair grow, and this is the lower portion. This is the jaw. See another diagram. This is the brain. This is present inside this skull I have just shown you. In this skull, in this diagram, you can see this is the front part and this is the back part. This is the upper part, this is the lower side of the brain, and this is what is called as brain stem. You see, these are the areas which those who are a little associated with the medical side know. This is the corpus callosum, and this is the cerebellum. This portion is the cerebellum. So see, cerebellum is located to the back of your head, here back, because this was the front, this was the back. So this cerebellum is located towards the back of head, and why I am telling you this is, I will come to it a little later when you will understand what does it show you, what does it mean. Now see another diagram. Here in this diagram you see this is cerebellum, this is these are two hemispheres. Like brain has got two separate parts, one left, one right. They are called cerebral hemispheres. These are called cerebellar hemispheres. Cerebellar hemispheres. And in between there is a unilateral structure like this. This is called vermis of the cerebellum. This is called the vermis of the cerebellum. Besides these two things, you also need to see what is this. This is the diagram to show you the testes and vas deferens. See, this is the scrotum, and in the scrotum this is the testes, and in the testes this is the epididymis. This is the part which produces the secretions, and testes produce sperm, and all this enters this tube and reaches the exit during intercourse, and this is the process of reproduction. This channel is called vas deferens. Testis, epididymis, vas deferens. What is their significance? Again, I will tell you as I go a little further in this explaining the effects of the alcohol. Now imagine what happens. Can alcohol affect your body? Yes, it can affect your body. Can it affect your brain? Certainly yes, it can affect the brain. It can produce temporary blackouts which may be short term or little longer. It may be fragmentary or persistent. There may be amnesia, which is described differently. I am not going into details of amnesia. The sleep may be disturbed. Some people take a drink at the bedtime that it helps them to sleep. They can sleep alright, but the sleep is a disturbed sleep. This is not a refreshing sleep. There may be disturbing dreams during this sleep. And the stages of sleep, they are also shortened. For example, REM sleep, REM, it is written in capital words, in capital letters. REM means rapid, E stands for eye, and M for movement. So rapid eye movement sleep is one part of sleep in which you are sleeping, your eyes may be closed, but your eyeball is moving rapidly. This is called rapid eye movement sleep. And then of course there is a deep sleep in which you don't have any feeling left for the outside world. And then of course you also know there is a light sleep also, in which you are partly aware of the what is happening around you, but actually you are asleep. Then there can be more changes in this internal system, like for example the judgment is impaired after drinking, and though person becomes a little more confident in the beginning, but as the amount of drink increases, the problem increases and your judgment becomes impaired. There may be headache, nausea, vomiting, and there may be temporary cognitive deficits. What are cognitive deficits? The functions like memory, language, these are called cognitive functions, and there is a disturbance of these functions. Chronic use of alcohol, those who take it regularly over a long time period, can develop peripheral neuropathy. Peripheral neuropathy, what is peripheral neuropathy? These are nerve fibers. The longer nerve fibers are affected first. Thus, you find changes on your feet before you find changes on your hand, and you find changes in your feet and hands before you find changes on your legs and arms. The repeated drinking can lead to temporary memory impairment. This is another problem, that temporary memory impairment can occur. There can be episodes of intense sadness in those who keep on drinking. The drinking may produce hemorrhagic gastritis, and it may affect the esophagus as well as the stomach. The incidence of cancers in those who drink regularly, particularly in women, it is 1.4 times more common, the cancer of breast in women. What I want to say is, in women, when they are drinking regularly, their chances of getting breast cancer is 1.4 more times than in those who are not drinking. The cancer of esophagus is 1.5 times more common in those who are drinking, and if you are drinking more than 5 drinks per day, you will also, there is 5 times increase in many cancers, and heavy drinking can lead to deficiency of folic acid in these persons. Then of course it can decrease the production of WBC in your body. For example, it will also produce mild platelet deficiency called thrombocytopenia. So mild thrombocytopenia is there, but it improves after abstinence, unless there is a congestive splenomegaly. And in cardiovascular system, what happens? Is it affected? Yes, it is affected. It can cause acute drinking, can cause slight increase in the slight fall in blood pressure, but the cardiac output increases, and this is compensatory mechanism of the body. Though blood pressure is one part of cardiac output, but whereas the blood pressure decreases due to vasodilatation caused by alcohol. Vasodilatation means the blood vessels, they expand, and when they expand, the peripheral resistance becomes less, and therefore the blood pressure also becomes less. So there is slight decrease in blood pressure, but in chronic people there is a increase in the blood pressure. The coronary heart disease or coronary artery disease or ischemic heart disease 6 times more common in those who drink regularly. There can be cardiomyopathy. That is a very serious condition. The person develops, the fibers become undergo degeneration, and some of them they hypertrophy also. So this is a sort of congestive cardiomyopathy. It is a congestive cardiomyopathy and can be little difficult to treat. Now, what is the effect on kidney function and sexual functions? It affects the sexual functions. This can lead to testicular atrophy. It can lead to atrophy of the vas deferens. It can decrease the semen volume. It can decrease the sperm count. In women, it can cause shrinkage of the ovaries. It can cause amenorrhea. It can result in the spontaneous abortions. There are so many effects of drinking, like smoking. This is another worst vice. So I will suggest all of you not to be tempted to drink, because there is there may be an opinion advantage. For example, sexual drive increases, but erectile function diminishes. So what do you gain by increasing sexual drive? Nothing. Similarly, the other things, you are rather in the long term harming yourself by increasing your blood pressure and causing changes in your body. So friends, these two vices I want to tell you in little more detail, that avoid these things. In addition, also alcohol causes tremors of the extended fingers, fine tremors like in thyroid disease, thyrotoxicosis or hyperthyroidism, and therefore here also you have to keep in the alcohol in mind. Like smoking, this can also cause the tremors. The palms may become red also. So remember, friends, in short, that alcohol or ethanol drinking can affect your body. It can affect your nervous system profoundly. It can affect your cardiovascular system, causing difficult problems and heart attacks, cardiomyopathy, and it can affect your sexual function, causing erectile dysfunction and testicular atrophy in female, causing difficulties in pregnancy, causing spontaneous abortions, shrinkage of the size of the ovary, and in males, as I said, there can be delayed sexual development, as well as there is atrophy of the testes. So these are some of the important abnormalities which I have told you about the drinking, and I will suggest you not to get to drinking. An occasional drink may be okay, but not regularly. Not regularly. The safe limit as laid down by these experts is less than 2 small packs in a day. Less than 2 small packs. That means 1.5 pack, that probably is harmless. Then also you have also to think of whether you are obese or not. If you are obese, if you are overweight, or you want to reduce your weight, then alcohol is bad for you because it immediately burns to give you calories, and your body requires calories to function. So body has got its calories, so it does not use the calories from the food which is stored in the body, increasing your weight further. So please be very careful that even if you have ideal weight, uh, then even then you should be avoiding alcohol as far as possible. But if the circumstances are such that you have to take one small pack, well diluted, and take not more than one and a half. Try to limit it at that stage. And then if the one virus goes in hand in glove with the other, when you drink, you also like to smoke also. So you are putting two evils on your body to create problems for you. So friends, be careful for your health and do not get into these problems. Thank you very much. See you next time with some other interesting topic.